Okay, there you go.
Hi, my name is Robin, and I'm going to discuss Ebola. Ebola was first discovered in 1976 in what is now the Democratic Republic of Congo. It was discovered near a tributary river of the Congo River called the Ebola River. It has, other than this year, only been discovered in western parts of Africa and the Philippines. Ebola is the Ebola hemorrhagic fever, and it's a virus that is severe and only sometimes deadly in humans and primates. There's 5 types of the virus, but there's only 4 types found in humans. Transmission to humans is commonly from primates, which can be transmitted from bodily fluids of the animal, or if someone is to cut open or eat an infected animal. Humans pass the disease through bodily fluids as well. It can also be passed through infected needles, and some say it can be passed through sexual activity, although that is not known yet. Ebola symptoms can begin within 2 to 21 days of exposure. The first period is the incubation period, or the period before the symptoms actually start, and this can show things such as arthritis, lower backaches, chills, fevers, and fatigue. After this period, symptoms can show fevers around or over 101.5 degrees, severe headaches, joint or ankle muscles, chills, and weakness of the body. Once these begin to occur, there are more severe symptoms such as bleeding from the eyes, ears, nose, and mouth, eye swelling, chest pains and coughs, internal bleeding, or severe weakness. If it progresses to a deadly point, there could be multiple organ failure, jaundice, delirium, seizures, or even a coma. Ebola can be diagnosed through multiple tests, such as CBC or complete blood count, electrolytes, coagulation studies, liver function tests, and virus-specific antibodies. Once you're diagnosed with the virus, there is no treatment. There are medications out there, but none of them have been known to work. If you're diagnosed, you will most likely be put in isolation in the intensive care unit, and the only thing doctors can really do is treat you for infections that occur while you were in there, or things such as replacing blood during blood loss, or keeping an eye on your blood pressure. Ebola does not have a 100% mortality rate. On average, since the 70s, it's had about a 67% mortality rate. The only cases that have had a 100% death rate are cases where there have only been 1 case, which has happened 3 times. There are people who do recover from this, and it is unknown how some people recover and some people don't. But once you do begin to recover, you will have symptoms such as hair loss, fatigue, headaches, eye inflammation, or liver inflammation. Even though it was discovered almost 40 years ago, the United States has not seen a case until now. It began in some countries in West Africa, and the United States became a case when a man traveled from Liberia, one of the West African countries, to Texas with flu-like symptoms, not knowing he was infected. He actually visited the hospital twice before he was diagnosed. He was sent home 2 different times, and once they diagnosed him, they put him in isolation, and he ended up dying 9 days later. And through a breach in protocol, 2 other nurses had been infected with the virus. Following hospital protocols and isolation protocols is one way to avoid contracting Ebola. Other ways is to stay away from known epidemic areas, to avoid any research on animals that could possibly be infected from these regions, and to avoid meat from wild animals in African countries. Also, if you have to end up taking care of an Ebola patient, such as a loved one, make sure you always wear your surgical equipment and protective gear. And the major thing is An Ebola patient who has died is still contagious, so if a loved one dies from this, you and healthcare officials need to make sure that when planning a funeral and going through with that, you should also wear your protective gear. All of this could help prevent an irrational number of cases in our nation.